Hello, and welcome everyone to today's webinar entitled Understanding Dementia and Reducing Your Risk, How Faith Leaders Can Support Their Community. Thank you so much to Adrian Miller and the Colorado Council of Churches for putting on this important webinar on this important topic. My name is Kelly Ostoff, and I am the Senior Director of Programs for the Alzheimer's Association of Colorado, but I also sit on an action coalition sponsored by the Colorado Department of Public Health and Environment that is implementing the state plan on Alzheimer's disease and related dementias and creates an overarching direction for the next couple of years and outlines actions to advance risk reduction and early detection, improve outcomes for all people living with dementia, and enhance the lives of care partners who live, work, and play in Colorado. The state plan takes kind of a multi-functional approach to addressing Alzheimer's and dementia from a public health lens. It looks to develop policies that improve the lives of people living with dementia, their caregivers, and people who support them. More so, it works to assure a competent workforce. Additionally, the state plan looks to monitor and evaluate programs and data that enhances the overall landscapes of dementia care. What brings me here today is that I am the co-chairwoman of the E-Work Group, which stands for Empower and Engage. This work group is tasked with creating partnerships like this one with the Colorado Council of Churches to advance education around dementia, resources available, and brain health, and create meaningful partnerships that enhance our reach, like this one today with the Colorado Council of Churches. My hope is that if you're watching this or you're joining us today, that if you represent a faith community, we want to work with you. We want to take this on the road and spread this important awareness and education in partnership with a community like yours. These partnerships really allow us to grow our audience and reach more people. So please reach out. Please reach out through Adrian or through me or the State Plan Action Coalition. And we'd be happy to bring this type of education and additional resources to your community so that you as a faith leader or member of a faith community can take advantage of what's offered to you to better serve your members. Please know we are here for you. You're here today likely because you acknowledge that Alzheimer's and dementia is impacting your community. You acknowledge that your members are either caring for someone with dementia, living with dementia themselves, or possibly they're concerned about their own brain health as they grow older. And each of us are growing older every single day. Faith leaders are often the first people who people turn to when they're in some sort of a crisis, especially when it involves their family or their health. And that is why we see faith leaders and faith communities as such valuable partners in this work, because you are a trusted person. You create trusted spaces where people gather to receive information, support, and education. And because your members, your communities are aging and they are taking care of aging family members, we know that there is more need for this information and education in your communities. I was supposed to be joined today with a current faith community partner who is going to speak on the value she has seen in her own faith community in partnering with the Alzheimer's Association to offer education and support to their members. Unfortunately, she wasn't able to join me, and so I've asked her to create a little bit of a testimonial as to why, directly from a member of a faith community, why offering dementia education and support and brain health messaging in that faith community is so important. She says, "My passion to decrease the stigma of dementia and to reduce isolation of both the person with dementia and their caregivers." That's what brings her to this work. "I think that creating an inclusive, dementia-friendly environment benefits everyone in the community by fulfilling the core values of service and care that are values that are shared by most faith communities." So you can see that there's a natural alignment and congruence between helping people through that faith lens and helping people in partnership with the Alzheimer's Association to offer this important education and support. There are clear benefits in involving the work of the Alzheimer's Association and offering education and support in the faith community setting. The benefits for the faith community themselves, she feels that it fulfills a spiritual calling of either the faith leader or the elders or the members to serve others. It offers educational growth opportunities for the members and leaders and community at large. It offers intergenerational connection. In fact, 2/3 of caregivers are under age 65. So many people have felt for many years that Alzheimer's and dementia was something that only older people needed to care about. But in fact, it is something that impacts the entire population regardless of age. So maybe your community is older or is aging, or maybe your community is on the younger side of life. This is really something that is important to tackle regardless of the makeup of the community. Dementia and Alzheimer's does not discriminate, and it impacts us all. Offering education and support around dementia also benefits caregivers, especially when it's done in a faith community environment, because it builds that support network that is so important that caregivers need, but in a trusted and comfortable space that they are familiar with, where they're already going and seeking support. It reduces the stigma and isolation that occurs when someone has dementia. Someone may stop going to church if they have dementia or their loved one has dementia. But once that entire community, especially stewarded by the faith leaders, invests in dementia education and support as a community, it creates a more dementia-capable space for worship and spiritual care, and therefore reducing overall stigma and isolation by hopefully continuing to welcome caregivers and people with dementia into that environment. It enhances spiritual care based on people's needs. When faith leaders are more knowledgeable about dementia and Alzheimer's, brain health, the services that are available, they're able to better care for their members even through that spiritual lens, because they're able to adapt their approach to what someone might be going through when they're serving as a caregiver or living with dementia themselves. It also benefits people with dementia who might be members of your community by offering spiritual and emotional support during a really difficult disease process. So a faith community prioritizing this type of work and acknowledging that Alzheimer's and dementia impacts their community creates a safe space for people living with dementia that is hard to find, because isolation is a very common experience when someone has dementia. So this type of partnership can reduce isolation by building community. Additionally, it ensures a sense of purpose and that spiritual care remains even if someone is living with dementia. So in summary, I really think that this speaks to why it is such a natural partnership between the Alzheimer's Association and faith leaders and communities to offer education and support in the setting of a faith community, because it benefits the community itself, its members who might be caregivers or living with dementia, and it also provides a public service to the community and a place for people to gather to receive really important education and support. I always like to start out with a little bit of data to talk about why does this matter on a larger scale. Certainly, I've mentioned that it's likely members of your faith community are impacted. Either they're living with this disease themselves, or they're serving as a caregiver, or they're concerned about their own brain health as they grow older. Likely, you have been impacted yourself, and so you know that this matters. But certainly the data justifies the case that this is a topic and an issue that faith communities should take on. We estimate that over 7 million Americans are living with Alzheimer's, and this is pulled from the 2025 Alzheimer's Disease Facts and Figures report that the Alzheimer's Association publishes. Not only are people living with this disease impacted, but so too are their caregivers, their family, their friends, their chosen family, their faith community. And we estimate that 12 million Americans are providing unpaid care to someone with Alzheimer's or dementia. So this is what I call a family system disease. It is something that not only impacts the person with it, but it impacts that person's family and friends and chosen family and community. Especially as the disease progresses, someone with dementia might not be able to recognize that they have it at all. But as that progression happens, their caregivers, their community surrounding them is acutely aware of what is happening. So it truly is and can be a caregiver disease. And offering important education and support can lighten that burden a little bit and show leadership and investment from the faith community. Now, what I find interesting is that if these 12 million Americans were paid for the care that they are giving, that care would be 19 billion hours and it would be valued at $413 billion. So this is also an economic issue. Our unpaid caregivers play a critical role in the landscape of this disease. Now, when we look at actual costs of Alzheimer's and other dementias, in 2025, it cost the nation $384 billion. And if nothing is done to change the trajectory of the disease, either through treatments or risk reduction through brain health promotion, these costs could rise to nearly $1 trillion. So that's a pretty significant economic concern. And one of the reasons why it is so important to tackle this now, to support the people who are currently living this disease, either with it or caring for someone, but also to join us in our efforts to spread brain health messaging for risk reduction. Now, when we look at that data on the Colorado level, we estimate that nearly 91,000 Coloradans over age 65 are living with Alzheimer's disease. And in Colorado, 177,000 Coloradans are serving as their unpaid caregivers. And if we were to look at what those caregivers do each year, again, unpaid, they would have provided 307 million hours of unpaid care. And if they were paid for that care, it would be valued at $7.249 billion. And that's just in Colorado. We know that there's a pretty significant workforce shortage, which is why through CDPHE and the State Plans Action Coalition is working to address those workforce issues. But because Colorado's older adult population will double by 2050, and that's only in 25 years, and because age is the #1 risk factor of developing Alzheimer's or another form of dementia, we must do something now to prepare for the future. And so that is why the State Plan Action Coalition, again, through CDPHE's efforts, that's why we are looking to advance the overall public's understanding of Alzheimer's and dementia and connect people through these partnerships to valuable education and support. I want to speak first to the unique experience of dementia caregivers. Now, caregivers can experience depression, anxiety, stress, financial burden for a number of different diseases. But the research shows that dementia caregivers carry a much more significant burden than caregivers to other diseases and conditions. We estimate that dementia caregivers have twice the average out-of-pocket caregiving costs. We know that dementia care itself is quite expensive, and often caregivers have to step out of work to eventually provide 24/7 care to someone. We know that because dementia and Alzheimer's can be quite isolating, right? Someone could be living with it, either with it or caring for someone, and their family, friends, neighbors, community just stops coming around because they don't know what to say or how to interact with someone with dementia. And because of that isolation, 30 to 40% of dementia caregivers experience depression. Even more, 44% experience anxiety. And we know that women, not only are they more of the caregivers, but they experience an elevated level of stress because of caregiving. So when we partner with organizations and faith communities, it's important to realize that not only are we looking to enhance the lives of people living with dementia, but we also want to support the caregivers. So many of your members might be a caregiver to a parent in another state. And so often caregivers can be a hidden population that you might not know that they need these educational and support resources. I mentioned that age is the main risk factor for Alzheimer's disease and other dementias. So as we get older, our risk for developing Alzheimer's goes up. When we look at the population over age 65, about 1 in 9 has Alzheimer's or another form of dementia. When we look at the population over age 85, so going from 65 to 85, it jumps to about 1 in 3 or 1 in 2. So with that, we know that as age goes up, risk for developing Alzheimer's and dementia goes up as well. Specifically, after age 65, the risk of Alzheimer's for someone doubles every 5 years. Now, it's important to note that age is not a guarantee to develop Alzheimer's. So not all older people have Alzheimer's or another form of dementia. That's one of the most common misnomers out there, that as you grow older, this is something that is supposed to happen. And that's just not correct. And that philosophy, that train of thought leads people to think, well, I don't really need to learn about Alzheimer's or dementia because it's just a normal part of aging. But that's really not true. It means something else is going on, and education and support around that can actually enhance the experience of everyone involved. We know that after age, family history and genetics play a pretty significant factor in risk. So people with a direct relative, like a parent, a sibling, they do have a higher likelihood of developing this disease. So age and family history are pretty significant risk factors. Additionally, genetics also play a role. And I wish I had more time today to talk about the genetic implications. But I think the biggest takeaway is, while certainly family history and genetics can increase risk, people without any family history at all or any of the genetic markers are still at risk themselves. And so oftentimes people will say to me, well, Kelly, I've never had Alzheimer's in my family, so I guess I'm good. And I always want to respond with, I wish it were that simple, but it's really not. People, even if they've never had any family history, are still at risk. So this is something that all of us are at risk of developing as we grow older. The research and science shows us, however, that there are communities of people that have higher risks than others. Communities of color, specifically the Black and African American population, is twice as likely to develop Alzheimer's. And the Hispanic and Latino community is 1.5 times as likely to develop Alzheimer's. And in addition to carrying an elevated risk, oftentimes communities of color face discrimination and racism or lack of access to healthcare, and that might further complicate their experience with the disease. And so this is why not only does the Action Coalition that is implementing the state plan and the Alzheimer's Association, that's why we take a health equity lens in this work, is because we know that to reduce those health disparities, we have to involve all people in research and care and education and support. Additionally, 2/3 of those living with Alzheimer's are women. I mentioned earlier that the majority of caregivers are women, but so too are the majority of people living with Alzheimer's. So women carry an elevated burden in this disease experience. Now, many times people say, well, that's because women live longer. And so that's why more women have Alzheimer's than men. And the research is showing us that that's really not true. It could be due to other factors, like maybe hormonal changes or life experience as to why women are more likely to develop Alzheimer's than men. But I think the takeaway here is that communities of color and women have unique experiences in living with the disease and disease prevalence and care that it is important to talk about in an inclusive and equitable way. At the Alzheimer's Association, we have a lot of great resources that I'll touch on throughout today's presentation, but one of the best is our 24/7 helpline. We know that oftentimes caregivers, people living with dementia, they need help at unusual times, 2 o'clock in the morning. And so our helpline is available 24/7, 365 days a year. Our helpline is staffed by master's level clinicians who speak not only English, but Spanish. And so that is just one way that we are looking to serve these communities that carry elevated burdens is through programs and services that are not only inclusive, but also accessible in that language. Additionally, we have a number of great written materials and educational programs that are offered in Spanish as well. Another unique population that experiences Alzheimer's differently in this conversation is those with younger onset. And I want to touch on that for a minute. I spoke to how age is the main risk factor, that as people grow older, their risk goes up. But it's important to realize that people under age 65 can develop Alzheimer's as well. It's not as common, but it can happen. People in their 40s, their 50s, their 60s, their 30s even can develop younger onset Alzheimer's. And that experience has its own unique challenges. People with younger onset can experience a longer and more frustrating diagnostic process because their symptoms might be incorrectly attributed to something else. Their physician may say, you're too old to develop Alzheimer's. Only people older than 65 develop Alzheimer's. And so their diagnostic process can be challenging because of some of those incorrect assumptions. Their symptoms might be brushed off as stress or menopause or lack of sleep. And so it can take people with younger onset longer to get a diagnosis. The experience, especially of caregivers, is unique too. Oftentimes people with younger onset are at the height of their career. And because of their symptoms, they have to retire early. Or a caregiver to a spouse with Alzheimer's who is younger might also have young or teenage children still in the home. So they're providing care not only to their spouse, but children. So they can have a unique experience just due to the realities of seeing Alzheimer's at a younger age, under age 65. And so the Alzheimer's Association has developed specialty programming for this population to meet its specific needs. For example, we have an adult children support group, and many of those members are caring for parents in their 80s. They might be in their 60s, but they're caring for older parents. And an adult child to someone with younger onset might not feel that those are their peers because they might be retired, and younger onset adult children caregiver are not. They might be still in college or high school. So we developed a support group for adult children to those with younger onset. And that's just one way that we look to serve people in ways that is inclusive and accessible and meaningful to them. Now, certainly the younger onset population is a much smaller population than the overall population living with Alzheimer's. But I really think it's important to talk about their experience because it is unique in and of itself and brings its own unique challenges. Next, we're going to talk about and offer some disease education. And this is one of the ways that we would hope to partner with your faith community, is by offering this disease education, just general awareness to your members in the community at large. There's so much misinformation out there about Alzheimer's and dementia, and that is our effort at the Alzheimer's Association to provide accurate and science-based and current information and education that will help people just be more aware and be better caregivers or navigate the disease more easily. Dementia and Alzheimer's, even though they're often used interchangeably, are two terms with different meanings. Dementia is an umbrella term that is used to describe cognitive changes that are severe enough to impact daily life. So our brain does cognitive stuff in its most simplistic terms. It is our cognitive organ. And again, dementia is an umbrella term for a variety of symptoms associated with cognitive change or a change in cognition. It can and often is short-term memory loss, but dementia symptoms can include things like issues with thinking and learning, so challenges in learning new information or new processes. It also can be challenges in completing familiar tasks. It can include personality and mood changes, new issues with reasoning, judgment problems, visual and spatial and physical changes. So dementia is a term, it's kind of a catch-all for a variety of symptoms. I mentioned earlier that dementia is not a normal part of aging, even though age is a risk factor. So it is not correct to say, well, dementia is due to old age. We have learned that that is just not true. Dementia, when these symptoms present themselves, means that something else is going on. Alzheimer's disease is a disease of the brain that is the most common cause of dementia. Alzheimer's disease causes about 60 to 80% of all dementia, and it has some pretty specific early symptoms. And the main symptom that we associate with Alzheimer's disease is short-term memory loss, which presents itself in repetition, repeating a question or a story, or forgetting where something was placed. But people also may experience word retrieval challenges and other symptoms as well. But short-term memory loss is often what we associate with that early stage of Alzheimer's disease. However, there are other causes to dementia, including vascular dementia, dementia with Lewy bodies, frontotemporal dementia, etc. And the cause of dementia will translate to different symptoms. So different causes of dementia have different symptoms, especially at first in that early stage. Alzheimer's disease is thought of as a buildup of these amyloid plaques and tau tangles in the brain, on the neurons, and inside the neurons. And because of the part of the brain it impacts at first, that's why those symptoms are what they are early on. Dementia with Lewy bodies, however, impacts a different part of the brain, and it may be a buildup of other disease elements in Alzheimer's. And so dementia with Lewy bodies often include more significant sleep disturbances as an early symptom. Additionally, people with Lewy body dementia often have more paranoia and hallucinations early on, whereas with Alzheimer's, those things might not come until later. Frontotemporal dementia impacts at first the frontal part of the brain that is responsible for making good decisions and judgment. And so someone with frontotemporal dementia may not experience memory loss at first, but they might experience pretty significant judgment issues. Frontotemporal dementia often, not always, is accompanied by aphasia or a loss of language. Frontotemporal dementia is more commonly known about today because Bruce Willis has recently come out with an FTD diagnosis with aphasia. So that is to say that Alzheimer's disease is the most common cause of dementia. Dementia is a set of symptoms. Alzheimer's disease causes about 60 to 80% of dementia, but there can be other causes as well. That is why dementia is not a very clear diagnosis. Dementia is a recognition of symptoms, and it means that it's important to find out what's going on. because sometimes there could be something happening causing those cognitive symptoms, those cognitive changes, such as vitamin deficiencies or sleep issues or unmanaged diabetes. And those things could be reversible. And so dementia, not always, but some forms of dementia or some presentations of dementia can be reversible. So that's why it's always important upon recognizing the symptoms of dementia to ask, what's going on? What's causing those symptoms? Because if it is one of those reversible things, that would be important to explore. Or if it is one of these other diseases or conditions like FTD or Lewy body or Alzheimer's, it's important to know what the cause is because each progress differently. Each have different treatment and care plans. Now, many people have said to me, well, Kelly, my grandma had dementia and then it became Alzheimer's. I've heard that a lot. And that really isn't correct. So dementia does not turn into Alzheimer's. Many people think it does. It doesn't. However, that might have been how it was recognized, the order in which it was recognized. Oh, the dementia symptoms were acknowledged, they were identified, and then it became clear as the disease progressed that it was Alzheimer's. But Alzheimer's disease would have been what was going on in the brain causing that dementia in the first place, if that was in fact the cause. In fact, what's really interesting is there are advancements being made in diagnostics and treatment, but especially in the diagnostic space that's telling us that Alzheimer's disease builds up in the brain sometimes 20 years before someone shows the symptoms of dementia. While that doesn't have implications for clinical care today yet, it is being used in clinical studies. And soon, we're hoping with earlier and earlier detection of disease that there could be in the future a time when someone is diagnosed asymptomatically, where we can detect the disease before someone develops those cognitive changes. Now, again, in the clinical care space, we're not there yet, but it is an interesting way to think about this disease. What I tell families is dementia are the changes you're observing in someone. It's the repetition. It's the issues with following instructions or navigation, personality and mood changes. Alzheimer's disease, if that is the cause, is actually kind of what's happening in the brain. So in short and in summary, Alzheimer's is a brain disease that causes problems with memory, thinking, and behavior. It is identified and seen in the brain as a buildup of these plaques and tangles, at first in a specific part of the brain, but because that disease progresses throughout the brain and at first causes neurons not to work as well, but eventually causes them to die altogether, symptoms will eventually grow more severe where someone will need around-the-clock 24/7 care. So while at first that in that early stage, symptoms such as memory loss might be mild. So they might just, repeat a story, but otherwise they're able to do other things. But as that disease progresses, again, nearly all abilities are affected and someone will need around-the-clock care. This is a visual picture of what Alzheimer's disease does in the brain. And this can be a medical way to think about Alzheimer's and dementia. But to me, I think it teaches us empathy. Empathy in understanding what people living with Alzheimer's are going through. On the left hand of my screen, we have what's considered a normal, non-diseased brain. And on the right-hand side of my screen, we have a brain that has been impacted by Alzheimer's disease. So those amyloid plaques and tau tangles have at first caused neurons not to fire and work as well as they once did, but eventually will cause neural death. And we actually see the atrophy, brain shrinkage. Oftentimes, caregivers will come to me and they'll say, how do I get my loved one to stop repeating that story over and over again? They have told me this story 10 times today, and a lot of the details are wrong. And so, how do I get them to understand what's wrong and what's correct? And what I say is, think of what's happening in their brain. You and I have the ability to create that memory, to understand that information might be incorrect that needs corrected. Someone with Alzheimer's has lost that ability in the brain. And so it is on us, therefore, to be empathetic in understanding that experience. So to me, this gives me a framework to understand what's going on, to have a little bit more compassion for the person living with the disease, to understand what's happening and why those things are happening. At the Alzheimer's Association, we talk about the 10 signs and symptoms of Alzheimer's. Number one is what people often associate with Alzheimer's, short-term memory loss. But Alzheimer's is so much more than that. And especially when we think of those other dementias that might have different primary symptoms, it's important for us to understand that yes, memory loss can be a symptom of dementia, but it sometimes isn't the only symptom, and there can be other symptoms as well. So this type of disease education allows people to better understand what people with dementia are going through, and I think can normalize some of the changes and therefore create a more dementia-capable, inclusive environment. So in addition to memory loss, Alzheimer's often presents us challenges in planning or solving problems, difficulty completing familiar tasks, confusion with time or place, trouble understanding visual images and their relationship in space, new problems with words and speaking or writing, misplacing things, but then because they lose the ability to retrace those steps, remembering what they were doing, they're unable to find things. So we see a lot of lost items and misplacing things, decreased or poor judgment, withdrawal from work or social activities, and changes in mood and personality. Now, because of these changes, a caregiver or a person with dementia might withdraw from the faith community. They might have been a regular attendee going to their faith community for services and events multiple times a week. But because these things happen, they might step back and withdraw from things they once enjoyed. And so that's another reason why learning about dementia, learning about what happens when someone has dementia, and understanding approaches to adapt to those changes can hopefully welcome those people back into the community and allow them and encourage them to keep coming, because that withdrawal is really a significant symptom of not only Alzheimer's, but other dementias. Someone may exhibit one of these signs, some of these signs, or many of these signs. But we educate people on the 10 signs because we want people to understand that dementia is more than just memory loss. It can look like a variety of different symptoms. And because we're all unique individuals, we all might present those symptoms differently. So someone might experience these to varying degrees and not have some at all. There's this concept called cognitive reserve, where people who are more intelligent or more engaged in education can actually compensate for some of the changes. And so their early changes might not be as significant because, for example, when they forget what something is called, their vocabulary is so vast that they can easily think of a synonym for that word. So the symptoms present differently in each person, and especially when there's a different cause to the dementia, the symptoms can look different. Now, oftentimes people will worry, well, I forget names, or I forgot what something is called the other day, or I lost my keys last week. We all have lapses in our cognitive abilities, especially if we're stressed or we didn't sleep well the night before. But when these changes are significant enough that they're impacting daily life and independence, that's when it is considered dementia. So if you forget someone's name or a word, and eventually that word comes back, and it's not happening frequent enough where you can no longer participate in a conversation meaningfully and remember those things, that is when it would be time to be concerned. But oftentimes we're able to recover from memory loss, or we're able to remember that we had the memory loss. And so that is what we kind of consider like normal cognitive change. So again, dementia is when these things are severe, significant enough, they're impacting daily life. Someone is unable to recover from them or remember that they happened. Now, it's important that if someone is recognizing these changes in themselves or in a loved one, it's important to talk to your doctor or their doctor, because it means that something could be going on that warrants a full medical evaluation to determine, are these changes caused by Alzheimer's or something else? We are really hoping that the general public becomes more concerned of their brain health, both because there is some risk reduction and brain health habits that we can adapt to lower our risk of developing dementia. And I'll talk about those in a moment. But also because this is a changing time in Alzheimer's and dementia care and treatment. And so in the past, some people might have said, well, I'm not going to talk to my doctor about these changes because there's nothing that could be done, or it's just a normal part of aging. But truly, because of the changing landscape of care, it is important that if you're noticing changes in yourself or someone else, it's important to pay attention to those, to document them, notice how frequently they are happening. And if you're noticing something unusual, it's important for those to be shared with the doctor. And we want to detect this as early as possible. And that is because early detection and diagnosis can have a number of benefits. If someone is having cognitive changes and it's not Alzheimer's or another form of dementia, it could be that possibly they have a vitamin deficiency, or they're not managing their diabetes, and that's why they're having some cognitive change. So that's one of the primary cases of early diagnosis. Is it could be something else. However, if it is Alzheimer's or another progressive dementia, an early diagnosis allows for the person to plan for the future and participate in discussions and decisions around their future care when they have decision-making capacity. Unfortunately, if someone is diagnosed too late and they don't have their affairs in order, they may not have capacity to participate in decisions that impact themselves. So early detection allows them to plan for the future and be involved in those decisions. It also allows their family and their community to receive education. And I want to stress the importance of accurate education. So understanding the cause of dementia is important, because Alzheimer's disease, compared to other forms of dementia, look different. They have different progressivenesses and plans and symptoms. And so there are different roadmaps for caregivers to understand what to expect. And there are different treatment protocols. But with an early diagnosis, especially of Alzheimer's disease, it allows someone to explore more treatment options. They have more treatment options in the early stage, even in general clinical care, but especially in clinical trials. So this is an exciting time in the research happening around Alzheimer's. And while there are some disease-modifying treatments on the market that I'll talk about in a minute, there's also a ton of research going on through clinical studies and clinical trials, and an early diagnosis gets people access to those things. Evaluating memory and thinking problems can be a multi-step process. So I introduced you all to the signs, the 10 signs. I touched on how helpful it is for you or someone to document those changes. And that's just part of the process. What this evaluation might include is if someone is showing these signs, they may undergo a quick, short, written and verbal cognitive screening with their primary care physician. And what that screening does is it detects that, yes, cognitive changes have occurred and someone has symptoms where we need to figure out what's going on. So after this quick screening, what might be next to determine what is the underlying cause is a medical history, a physical exam, a depression screening, laboratory tests, and other cognitive testing that is a little bit more involved than the screening I mentioned earlier. And what those things are looking for is looking for something else like untreated depression, poor sleep, etc., that could be causing those cognitive changes. So after ruling out all those things, there are advancements made in diagnostic tools that are allowing people to understand what is happening in their brain early on. That includes brain imaging, such as a PET scan. A PET scan can show Alzheimer's in the brain and therefore give someone a more accurate diagnosis earlier. And it may include cerebral spinal fluid testing, or in the past few months, a blood test was approved and released to diagnose Alzheimer's disease or rule out Alzheimer's disease as the cause of dementia. So again, it's a multi-step process, but the initial step to take is to have a cognitive screening with the primary care physician to detect cognitive change. And it's super helpful to bring some data to that appointment, such as documentation of what's happening and how frequent those things are. I will add to this that what also is changing in the landscape of brain health is that there is more access to this cognitive screening for the general older adult population, even if they are not showing symptoms. So certainly, if someone is showing those symptoms that I talked about in the 10 signs, it is important for them to talk to their doctor. But someone without any symptoms at all, who is over age 65, may undergo this annual cognitive screening with their doctor as just another health screening in their annual wellness visit. And this is really going to revolutionize our ability to detect dementia symptoms earlier. So the Alzheimer's Association advocated for physicians to be able to bill for and get reimbursement for cognitive screening at the annual wellness visit. And that is huge because now there is more routine screening for cognitive change in our older adult population. So while in the past, we've just waited for symptoms to occur, now all older adults should undergo this annual cognitive screening, especially if they show symptoms, but it might start just because of age, just to develop that baseline and have it done as part of routine screening. Some people's doctors recommend this on their after age 65. Other doctors might not know that this is now routine, and a patient might need to advocate for themselves and request this cognitive screening. So there's still some variance there. And certainly, even though there are advancements in blood tests and other diagnostic tools, right now, those are only being used as a confirmation of diagnosis. It's not being used as a first step. So certainly don't feel like you have to go out and get access to all these tests. These tests are for a diagnostic purpose. However, that brief written and verbal screen that I touched on is being used as an annual health assessment for older adults. Currently, there is no cure for Alzheimer's. And so if it sounds too good to be true, it likely is. If something promises to prevent memory loss at this point in time, it is too good to be true. However, in the past handful of years, there have been advancements being made in treatments. There have been drugs on the market for decades that help manage symptoms associated with Alzheimer's disease. But for the first time ever, we actually have treatments given intravenously, such as Leqembi, or which is known as lecanemab or donanemab, that reduce amyloid plaques in the brain. And what the studies show around these treatments is when they remove the amyloid plaque from the brain through these treatments, someone is able to preserve their cognition for longer. So while there are new disease-modifying treatments on the market being used now in that early stage, they are not completely curing the disease, but certainly they give patients longer time with better cognition. And so this is another benefit in acknowledging our brain health, being aware of our cognition, being aware of our changes, talking to our doctors, seeking an early diagnosis, is because there are new and novel treatments that can help, released just in the last couple of years. And those treatments have the most impact in that early stage. Even though we are seeing these disease-modifying treatments and we anticipate this to look different quickly in the coming years, more treatments to become available that will improve the life of someone with Alzheimer's, we also still need to care for the caregiver. And so signs of caregiver stress is important to be on the lookout for these signs, such as denial of the disease, anger or irritability, caregivers themselves withdrawing from things they once enjoyed, elevated levels of anxiety and depression, sleeplessness, exhaustion, lack of concentration, health problems that take a mental and physical toll. And so education around the signs of caregiver stress is equally as important as education around the signs of Alzheimer's disease, because we have to continue to look out for our caregivers, even though there are new and improved treatments for the disease itself. As a faith community, I can imagine that you are concerned about its members. As a leader, you're concerned about the health and well-being of everyone in your community. And so education around caregiver stress and caregiver resources is just another way that faith communities can show investment in this topic, because it by turn shows investment in your members. It is critically important for caregivers to take care of themselves, exercise regularly, get plenty of rest, eat well, take a break, access respite care that just gives someone a break. Someone might be able to take a nap or go golfing or go to their quilting group that they once enjoyed. And just that moment of relief can have tremendous health benefits for the caregiver. We also, as I mentioned earlier, have a fabulous 24/7 helpline. And that is available day or night in English and in Spanish, staffed by master's level clinicians, where caregivers can receive personalized disease education and recommendations around care strategies that might make their life a little easier. So I've talked a lot about maybe the repetition or paranoia that might happen with dementia. Someone might think someone is stealing from them when they're really not. And it is our instinct to correct someone, to say, you know, you've already told me that story, or no one is stealing from you. Don't think that. It is our instinct to correct. But with dementia, learning a simple technique like don't correct, enter their reality, can make a caregiver's life so much easier. And our helpline not only does this individualized disease education and offer emotional support, but it can offer strategies like that caregivers can then implement and make their caregiving just a little bit easier. Additionally, caregiver support groups are a great way that caregivers can come together and receive support from people going through what they are going through and receive information and education from others who have been through this journey. And it gives them a time to connect with people who understand their experience. I often hear from couples where one of the spouses is living with dementia and the other is serving as the primary caregiver. They might say, we used to have a vibrant group of friends and they just don't come around anymore. They don't really know what to expect. Dementia is scary. They don't know how to talk to someone with dementia, and so they feel really alone. And for many, these support groups can become new families and new social circles for people. Many of our support groups across Colorado are offered at and in partnership with faith communities. And not only do they give a service to the members, but often community members from outside the faith entity itself come. And so it is a public good of the faith community to the general public. In addition to support groups, things like caregiver education, again, just learning that simple communication technique can be a really fabulous way to manage caregiver stress. And we have, for example, an empowered caregiver workshop that delves into deep topics like communication and understanding behaviors and how to take care of the caregiver. And those are fabulous educational programs that we love to offer in tandem with faith communities, again, for their members who we know are facing this, or to the general public as a public good. I mentioned the science and research happening around advancements in diagnostic tools and treatments, but there's also research being done around brain health, around how we take care of our brain across the lifespan. As a public, we talk a lot about heart health and other forms of health. We're starting to hear more about brain health. And what does that mean? There are several risk factors for cognitive decline and dementia. I mentioned those, right? We can't control our age. But there are things that happen to us across the lifespan from birth to death that impact how our cognitive our cognition ages. And there are things that we do along the lifespan that can increase our risk of developing dementia or can reduce our risk of developing dementia. So growing evidence, specifically from the Alzheimer's Association's US Pointer study, which was a large nationwide clinical study that looked at a large group of older adults. And what this study did was it had one group do certain things, implement healthy habits, but in a less structured way. And then the other group implemented these things in a very structured, regimented way. Both groups saw some cognitive benefit from implementing these healthy habits, but the group that was really regimented and really structured had better outcomes because of the regimen. And what this study also told us is that even if someone has never exercised, never eaten well, it's never too late to start. That even older adults who implemented these habits saw some benefit cognitively. So what the science is telling us is that there are things that we do and can do across our lifespan that increase our risk, but the reverse of that is can decrease our risk. So what are those things? They are, I think, the most common components of healthy living. So these healthy habits right here are not only good for all of our overall health, but they are being proven to be good for our brain. And the earlier we can implement these, the better, but it is never too late to start. And what these 10 healthy habits are is to remain socially connected. So that is important. Having social and community experiences that keeps someone socially and emotionally engaged is important. But it is also important for people to continue to challenge their mind, to stay in school. What that tells me is stay engaged in lifelong learning and challenging ourselves. Those two things are important, but it is also important to control blood pressure and manage diabetes and maintain a healthy weight. So to look over and care for our overall health not only has benefits for our heart and other organs, but it benefits our brain. Our brain also benefits from regular exercise, eating right, specifically things like the MIND diet or the DASH diet or the Mediterranean diet have been shown to be helpful. And to sleep well. Sleep, both in quantity and quality. When someone gets enough good sleep, their brain benefits. And of course, we want to protect our head, avoid head injury, and be smoke-free. So this is just another component of how we can partner with faith communities, is not only offer that disease education and education around communication and engaging with someone with dementia and supporting caregivers, supporting people with dementia by participating in that education, but we also can offer brain health education and risk reduction information. And this, I think, is giving us all a lot of hope that there are things that we can do to take control over our brain health. So yes, we're all going to age. Aging is something we cannot stop. It's happening every minute, every day. But even though our risk goes up as we age, we can do certain things to lower our risk. And that is really powerful information. There are other things like treating hearing loss that can also benefit the brain. Hearing loss, when it is untreated, is a pretty significant risk factor for dementia. So for some people, that might be their motivation to get hearing aids, is because they want to protect their brain. And so this type of health education is important not only for older adults, because yes, never too late to start, but this information is important for youth, for teenagers, for young adults, midlife adults. And so this is when this topic becomes one that really matters to us all. I want to end by just emphasizing, as I started with the testimonial from one of our partners at Joy Lutheran Church and Augustana Lutheran Church, where we offer regular education for their members, for the community. We offer resources to their leaders. We have support programming at. Here are just a few more ways that faith communities can partner and show investment in caring about this topic, caring about dementia education and support, caring about creating dementia-capable and inclusive spaces, and advancing brain health and risk reduction information. You can provide spiritual and emotional support by continuing to include people with dementia in spiritual life, and focusing on unique and comforting practices like prayer, music, visits, but a simple notion of just learning about what is to be expected with dementia and how to communicate with someone with dementia, or something as simple as creating a lower sensory room for someone with dementia to participate in worship in, can keep them connected to that faith community and not see them withdraw like they may without those supports. You can support caregivers by offering helpful resources like these classes and support groups, offering respite information and resources. It's also important, I think, for faith communities to acknowledge that not only are they offering spiritual care, but spiritual care is connected to physical care and therefore brain health. So brain health and brain health promotion and workshops around dementia awareness and brain health risk reduction strategies can also be a way to inadvertently serve that spiritual care that is at the core value of most faith communities. And you can create a dementia capable environment by offering education to staff and volunteers of the faith community. And so if you're interested in getting involved and offering these resources, call our helpline, reach out to me. We would love to offer physical resources, printed resources that people can pick up. Maybe they're afraid to go to a program or a support group, but they're going to grab that brochure on their way out. Or we can include some information for church bulletins on Sunday. And that might just be the blurb that someone needs that week. Call our helpline, share our helpline with others. It can be a lifeline to people living with dementia and caregivers. And just to reiterate, we have a really robust set of educational programs that include disease education focuses, our empowered caregiver workshop, brain health education, and support groups. And we love to expand access to these education programs and support groups by offering them at faith communities, because we know that someone might not feel comfortable going to an educational program at the library down the street, but they definitely feel comfortable accessing that education at their own faith community. And so partnering in this way allows us to reach more people who need this information, but also enhance the care that faith communities and faith leaders are already offering to their members. So thank you so much for your time and attention today. Please, I am going to stop the recording and I open it up for questions. But again, thank you so much for your time. And please know that we are here for you at the Alzheimer's Association to partner in serving your faith community as a faith leader with your members. Thank you so much.